Well, a warm welcome to this talk, Sunday the 26th of October, the year of grace 2025. I'm pretty sure I've got COVID again. I'm not sure this matters too much, but I thought I'd share it anyway, given that it's such a common experience. It's almost certainly one of the descendants of Omicron. I think we're on XFG.3 at the moment. This is counting for the majority of new cases in the United Kingdom. Basically, cold type symptoms, sore throat, things that you can all relate to. So it's Sunday morning now. So I was aware that I wasn't quite well on Friday night. Didn't sleep well on Friday. Didn't feel great yesterday. Kind of pre-dromal, really. You know, when you know something's going to happen, and then it localizes and sort of bad sore throat developed sort of yesterday evening overnight. You know, can't be bothered doing anything, don't feel quite right, disinterested, a bit grumpy, a bit of a blocked up nose. You know all these features. The main thing's the sore throat and can't be bothered doing anything really. Just feeling a bit unwell. I don't think my temperature's too bad at the moment. See what it's doing. Yeah, 37.6 at the moment. So that's kind of it's a low grade fever. Mine's normally quite a bit lower than that. So slight temperature, bit of a headache maybe, but nothing too bad. Things that you can all relate to. So, so a few things to talk about really. The first one is I'm really annoyed because, you know, we've got vested interests in the United States paying vested interests in China to cook up a new virus in a lab, which they then have the incompetence to leak on the rest of us. And this has been causing problems now for years. And it's going to go on causing problems indefinitely into the future with these new mutations and new variants of the virus to which we have limited resistance to. Now, we have a lot of resistance because the new type of viruses, in this case the XFG.3, shares a lot of epitopes, a lot of bits on its surface that the immune system will recognise as foreign, that it will have already made some immunity to. So that's why we get fairly mild, relatively mild illnesses. I mean, when I had influenza, I was a lot sicker than this. I remember with influenza, I was trying to get to bed and couldn't get off the bedroom floor. And then I thought, well, if I'm taken now, that's absolutely fine because, you know, you just feel so bad that you're dying. With influenza, nothing as bad as that, but things that you can all relate to, you know, the hoarse voice, the cough, the headache, the nasal features of this new unnecessary disease. So they've cooked up this massive cause of morbidity that's causing disease all around the world and suffering all around the world, and will go on doing so into the future. Just because someone chooses to jiggle around with some research and gain of function research in a lab, we all have to suffer for it indefinitely. And as I say, this is going to go on and on and on because, you know, the SARS coronavirus 2 is not going away and it will keep on mutating. It's a simple RNA virus. It just keeps on mutating. So what am I doing? Basically, not very much, the same as you. It's really important to rest when you have a viral infection. You cannot run off a virus. You know, so when you've got a virus, you need to rest. So the usual work, the usual exercise, you really can't do that. It's really quite dangerous exercising, especially vigorous exercise with a viral infection. So absolutely rest. I'm sure this is a virus, so I am not taking antibiotics. I've got a fever, low grade fever, 37.6. So that what's that in it's probably about 100. I'm not sure, about 100 degrees Fahrenheit. It's a slight fever anyway. So I am not taking ibuprofen. I am not taking paracetamol, acetaminophen, Tylenol, all the same thing. Because if my body has decided that my temperature is better being a bit high, then that's because it's improving the efficiency of my immune system. So I want to optimize the efficiency of my immune system by keeping my temperature high. So I'm not taking anything to bring my fever down. So I am not exercising, I'm not taking antibiotics, I'm not taking ibuprofen, the non-steroidal anti-inflammatory drug, and I'm not taking the paracetamol, Tylenol type of drugs either. I'm not taking those. So what am I doing? Well, I'm taking some extra vitamin C. So this is these are 1 gram ones with with I think we've got a bit of zinc added for good measure. So I quite like these fizzy ones, so just pop it in there and that dissolves. That's a gram with 15 milligrams of 15 milligrams of zinc and 1,000 milligrams of vitamin C. So take a bit of that. Personally, I also gargle with a bit of a very weak Lugos iodine, so just a shake of iodine, and you can stir that up. And if I have a spoon, I can stir it up. Oh yeah, and you can gargle with that. Well, I'm not telling you what to do. This is what I do. I gargle with that. You'll have to ask your doctor what to do, otherwise someone will tell me off. So, you know, iodine gargling with that, just 2 to 3 parts per million of Lugos iodine will have a virucidal effect, whereas paracetamol, Tylenol, ibuprofen have no antiviral effects at all. So resting, sleeping when you can, not sleeping too well with a sore throat. Now, my vitamin D levels are probably already fairly good because I take about 4,000 units of vitamin D a day. For people who have got low vitamin D, ideally the doctors would prescribe them some calcifediol. This is from the continent. You can't buy it in UK chemists because our state looks after us from potentially dangerous drugs, of course, doesn't it? And looks after us, so we can't buy things like calcifediol, which can be immensely useful in people that are vitamin D deficient. Nor indeed can we buy iodine in British chemists, even though it's immensely virucidal. We're not allowed to buy it because, again, our state takes such good care of us, and these potentially dangerous things, we're not allowed them. It'll give tens of millions of people experimental vaccines. That's fine. But, you know, things like, vitamin D, activated calcifediol, vitamin D, and things like iodine are way too dangerous. We can't have those. So, I mean, if you are low in vitamin D and you have got a new viral infection, then do ask your doctor for some of this calcifediol, because all the white blood cells in the body need activated calcifediol to work. They won't work without it, and that will work within. Well, this is reservoir form. It will work within a couple of hours. That I don't think your doctor will prescribe it because it's quite useful. So that's what I'm doing. What I'm not doing. You can relate to all this. You're probably as annoyed as I am. It's actually quite nice, that. Now, don't worry, I'm not going to inflict my gargling on you. Oh, I also put a bit of ginger in my tea as well. Lovely. Root ginger. Likely because I like it. I mean, it does have properties against some viruses, but I don't know. When I get colds and things, I just fancy a bit of ginger. Maybe your body knows what it needs. So, hopefully some interesting videos soon. But for now, I thought we'd share a common experience that millions and millions of us have. Of course, colds are always with us. But this is a new one that didn't need to be. Extra morbidity that's inflicted on the world by people dabbling around with viruses. Okay, this is bad. How dare they do this to us? But people are still experimenting with more dangerous viruses. So it's quite possible that a more dangerous virus could be released with a very high mortality, infection, fatality rate. That's quite possible. And that could be with us for generations to come as well, potentially causing mass fatalities into the future because of people messing around with dangerous viral research, which is still going on. So to say we're not out of the woods is an understatement. We could have a dystopian future to look forward to, but let's hope not. And in the meantime, I just thought I'd share what you have experienced in the last few months, what you will experience in the next few months. Sadly, has become a common human experience, but more common because of people fiddling around with viruses, which is really annoying. Anyway, for now, stay well and God bless, and thank you for watching.